everybody. Thanks again for joining us. We are here to help Gordon Dill with consumer expert Diane Lee. Diane, folks watching today have probably at least once or twice been extremely stressed out by the process of a big move. And if that's not stressful enough, now you got to be on the defensive for people trying to rip you off.
Yeah, Gordon, and you really are ripe for getting scammed when you're moving because so many people look online for a mover and don't understand exactly how it works and fall into a trap.
Even if you're not planning on moving anytime soon, at some point in your life, chances are you'll need to know how to properly vet a moving company. I'm 7 News consumer anchor Diane Lee with a powerful warning from an upstate woman so you can spot moving ripoffs.
Moving is stressful enough without the dread that you may never get your belongings back. For Tracy Vickery, her 2019 move to South Carolina was nothing less than traumatic.
Even just reliving everything that we went through, it's still hard.
Her online search had led her to a company called American Standard Moving and Storage out of Boca Raton, Florida. When she submitted a detailed itemized belongings list and paid her deposit, she, like many, had no clue she was dealing with a broker who sent third-party movers.
Right when I saw them, red flags started coming left and right. The gentleman was very unprofessional, had a dirty t-shirt, long, just very, and then a girl walks up who's pregnant.
She says they loaded her life's possessions in this rental truck, one she was supposed to share with another family. And then came the bait and switch, claiming she went over and had to pay for the whole truck.
And it was another $23.72. And I said, no, I'm not doing that. And they said, no, you can't do that, or you will not get your stuff back.
What we call it is a hostage move. They hold your goods hostage.
Dan Hilton, the executive director of the American Trucking Association's Moving and Storage Conference, says rogue movers are a rampant problem.
These are not reputable movers. They really are a version of organized crime.
How can you make sure you hire a mover you trust?
Sure. Well, a reputable mover has to have a DOT number.
The Federal Motor Carrier Safety Administration website allows you to look up that DOT number by entering the company's name. It also has a link to check if the company is insured. Plus, you'll find this checklist which explains steps to avoid moving scams, including getting at least 3 estimates, researching the company's standing with the Better Business Bureau, and reading any document before signing.
Whatever you do, try to hire movers who can come in person to assess your home so you don't get a lowball quote. If that's not possible, do a virtual tour where you show them not just your stuff, but the stairs, the exits, and don't forget the attic.
Here are some of the boxes that were delivered to me.
That's how it looked?
Yeah, this is glass.
Vickery says when her stuff finally arrived, much of it was broken or ruined. On top of that, she paid the extra amount, but the delivery kept getting delayed.
We had to sleep on a blow-up mattress for 45 days.
And then, the day her stuff arrived, they charged her even more.
And about how much money were you out total?
$6,300 is what I end up paying them instead of the $1,885.
7 News learned that while American Standard does have a DOT number, the company is not authorized to transport household goods across state lines. And despite our efforts to get company comment, its website is down and phone number links to an unaffiliated company.
I just hope nobody else falls for it and would ever get in the situation that we did.
Now, one of the best tools to avoid scams is using social media and local online networks to find recommendations. And you can file a complaint against a mover through protectyourmove.gov.
Unbelievable. There are so many hits in that story, Diane, and this is a talker. So, first of all, she says, oh gosh, the price went up. $2,300. She says, I had to stay on an air mattress. And I thought, oh, well, we've all had 45 days. Yeah. I mean, this is so much worse than the worst case scenario.
You can see how much pain it caused her. And I will say, as just someone listening to her story, and I'm sure viewers felt the same way, that you just feel pained. Like you can feel that stress that she felt during that time and that worry that, it's not just the furniture, Gordon, it's those photo albums and all those wonderful private, important things that we have in our home that that you think about and you wake up in the middle of the night and say, I wonder if I'll ever see my wedding photos again, things like that.
It does feel, and I think they call it in your story sort of a hostage situation, because they've already taken your stuff, and now you. If I'm in that situation, Diane, where a mover has come, they've loaded everything I own onto a truck, and they say, hey, we're jacking up the price by $2,500, which is a lot of money. I don't care who you are. Can I call the cops?
You can, and she certainly did, but they're going to come to your door and they're going to say, ma'am, this is a civil matter. I'm sorry. This is not necessarily a criminal matter at this point, because you did go into a contractual agreement with them. And at this point, they have loaded the goods in the truck. And so, if a customer had completely paid money and nothing had been done, then it could be potentially a criminal matter. But when some work has been done, that's sort of how these moving companies get away with not facing a number of criminal charges at this point. But really, Gordon, it's about preventing yourself from falling into this situation in the first place.
I'm glad you said that, because you lead me into my next series of questions, which is immediately when you mentioned this company, you went to their website, and I noticed it's a 2-star reviewed company, which should be a huge red flag. Are there other red flags where their prices surprisingly low for that kind of service, the kind of thing that should put you on your heels?
Definitely. Let me say, first thing that people should be aware of, and I hesitate to completely call it a red flag because there are reputable brokers, but I'm going to bring up the difference between a broker and a moving company. And Gordon, there's a checklist that we have access to that I'd like to show folks. Okay. So basically, the federal government has put together this checklist, and it's important for you to just ask yourself these questions, before you move, and on the moving day. Do you understand who you're dealing with? Is it the actual moving company, or is it a third-party broker that you've contacted that's acting like a moving company, and they've already been able to, hire a moving company, but they haven't really given you all the proper details, and so the moving company is going to charge more, and the broker's made promises, but the moving company says they can't follow through. You can really run into a lot of issues. So I think mainly, and that's really more the moving checklist that we saw. There is another checklist that you can find on our story website, WSPA.com/consumer, that has the real checklist of, is it a broker, is it not a broker, which is something that can be confusing, because you go on Google, you search, I need a moving company, you search the area. Oh yeah, pops right up, and it'll really look like they're all different movers, and sometimes they'll have great reviews, Gordon, but they might be, not necessarily accurate. But I would say, not that the moving companies themselves can't be also, creating a bad situation, but I would say you may want to opt for going with an actual moving company instead of a broker, because what the moving company tells you is much more likely to be accurate versus what the broker's trying to promise just to kind of make that deal. The broker kind of gets paid up front, and then they can somewhat wash their hands of it.
So about that company, I mean, not only 2-star review, but when you went back to do your reporter diligence to try and get in touch with them and say, hey, we're doing a story about you, they seem to have vaporized.
Yes.
Are they a real company at all?
They are, and they were a real company, and we always want to do our due diligence and also hold a company accountable. So I was very prepared and had ample time and made sure that I gave ample time to respond, but we really couldn't find any contact information that was still working. In fact, Gordon, let's do a little test here, because I want people to see this means of being able to look up a company, and you can do it by the company name. On this particular site, Safety and Fitness Electronics Record System.
And this is on the DOT
DOT website. We've made it easy for people, because you know how hard it is to find those pages inside government websites. So this is the exact one. And again, I posted this on our web story at WSPA.com/consumer. But here, as you see, we check the word name. That's the bullet point there that you would enter if you want to enter a name. If you actually know a DOT number, you can check GOT number. But we've checked name. Now, Gordon, press search. That's for American Standard.
American Standard.
Yep.
Okay.
All filled out. And right now, they are showing up as listed, so that's a hyperlink there. When you click on that link, you're going to see, as we scroll down, what we pointed in the story, that they're not authorized for
interstate and private. I believe that's intrastate and private, which means they can't go from state to state. And so long story short is they could potentially still be operating within a single state and just for private. Of course, her move was not a single state. It was from one state to another. But importantly, do you see, Gordon, there's a phone number listed? Mm-hmm. We called that phone number, and I'm not going to name the actual business that it goes to because they're a legitimate business, but it goes to a completely different business that when I called, I was patched through to corporate and I said, this number is being associated with a different company that's been associated with some scams. So you may just want to check to, verify that your number isn't being used.
But Diane, the DOT, and I know this is small type for the people watching on Plus, but it says it's still an active broker listed with the DOT. So if they have vaporized into thin air, the federal government doesn't even seem to know that.
So it's interesting. If we go back on it, and it is a little bit fine print, I'm actually going to put on my glasses for this one.
Yeah, I'm squinting as well.
So there is an area in here. Let's see. If you go to licensing, let's say licensing and insurance details, click on that. That is right by where it says not authorized for licensing and insurance details.
Here.
So we're clicking on there. Tell them you're not a robot for a minute.
Thank you.
Great. Oh, I hate
Guys,
this.
who at home wants to watch Gordon play the CAPTCHA game?
Good luck, Gordon.
Isn't this fun?
These always get me.
Look at this. Oh, this is fun. All right,
we could be doing this for a long time.
All right,
so we're going to search and then press search, I believe, at this point.
Do I want it on?
No, you're fine because we've got the DOT number. So let's just, and then click on the HTML for viewing details. So this company is actually inactive as a broker. Oh. So we had to go far in to figure that out. So even though they are, quote, authorized under the DOT for their DOT number, they are currently inactive. They have no licensing and insurance that would allow them to be able to operate. And this is how we felt comfortable that with no working phone number, with no working web page, and with that,
they're gone.
Yeah, they're gone. By the way, do you like that my glasses match my dress?
Yeah, that's very sharp. Very fashionable of you. Thank you. I have to say, you and I have been reporters for a very long time, and we've done this kind of government data search 1,000 times a piece, and even for us to track down whether this business is legit is a project. So for the consumer, it must be a nightmare on everything you do on the moving checklist to find this stuff out.
It really is. And so I say the simple way to do this is, and I know it's tough when you're getting ready to move because things have to move fast, but make sure that you get those recommendations, check with, even just a Google search can sometimes turn up some pertinent information. And as I mentioned, check with the BBB. They're going to, especially if you know the headquarters of that company, they're going to have reports on it. So check with the specific BBB at the headquarters of that company, and there's no doubt that they will have some reviews, whether positive or negative, and that's how you can help to base your decision making. You don't have to necessarily know the DOT number and look up all this stuff, though it can be helpful. But really, point blank, you have to really do your research because you can get taken so badly in this situation.
And Diane, maybe the final note to leave people with on this is it sounds like the poor victim in your story, her spidey sense was going bananas from the beginning on this when they showed up in the first place. And maybe in just a situation like this, if everything is telling you, gosh, this is wrong, they've sent a pregnant woman to come do the moving for
Wasn't that horrible?
Right? And so something's wrong. You know what, guys? Don't touch my stuff.
And you know what it is? The reason why this scam is so successful is because, Gordon, ideally, we would love to say, don't do it, but think about it. Most of these people, including her, are in this situation where they're expected to be somewhere. They're expected to move in.
I got to get out of this place.
Right. They got to get out of this place. There's probably a pressure on that because the rent's up or whatnot, or the house is sold. And so they are really desperate. So they want to believe that even though there are red flags, that it'll all work out in the end. And this is really what can happen. Her stuff was, by the way, I think she found out in the end, it was taken all the way. She was moving from Ohio and moving down to South Carolina, and she said it ended up in Chicago. They had taken it off the truck, put it back on once she paid that extra amount. And each time they took it on and off, she suspects that they basically just kind of threw it. That's how it ended up looking, at least.
Boy, I tell you, these kinds of companies, they pop up and they disappear, and they pop up and they disappear, and it's whack-a-mole to try and catch this kind of scam. So protect yourself. Diane's given us some good tips, some good advice to double check to make sure you don't get ripped off. How about we take a quick break, and we'll come back with some more money-saving, scam-preventing tips right here on Here to Help. We're back. Gordon Dill, consumer expert Diane Lee. We've already talked about how to protect yourself from something most of us do, which is moving. Now something all of us are going to deal with, Diane, and that is trying to save $1 or $2 on our health care.
Yeah, it can really be the biggest expense for so many families out there. So we looked into ways that people can save more.
1 in every 8 people in South Carolina has no health insurance. That's more than 500,000 earning too much to qualify for Medicaid, but too little to get an Affordable Care Act plan. Thousands more are underinsured with high deductibles they really can't afford. I'm 7 News consumer anchor Diane Lee. For those struggling, there are more options than you might think, some of which offer health care that's completely free.
Is this arm okay?
Yes, ma'am.
There was a time not too long ago when Michelle Luke, a diabetic dependent on insulin, faced a grim reality.
I could live in my car and get my medicines, or I could stay in my house and I could find some help.
She says she found a lifeline in the Greenville Free Medical Clinic, which covers primary care, specialists, and prescriptions.
I would have had to come up with essentially almost 2 entire paychecks a month just to cover my insulin.
Clinic director Susie Foley says they take only patients who are uninsured with household incomes of twice the poverty line or below, so the cutoff salary for a family of 4 would be about $62,000.
And the types of jobs that they're working don't offer health benefits. So they are truly the working poor and falling through the cracks and really not have access to health care.
You'll find at least 1 free medical clinic in every county in the upstate, and some have satellite offices to serve more. But there are other options if you don't qualify.
Check the weight and height.
Families who have insurance but not adequate coverage can still save at centers like Unity Health in Greenville.
How do you keep health care affordable for families here?
So we have a sliding scale program available for all of our patients with or without insurance, because even with insurance, if they have a high deductible, they may need to be on our sliding scale program.
Hi.
Nice to meet you.
Unity and centers like it also have bilingual translators.
It'd be difficult for me to be able to go to a different doctor where the cost would be high, and it would be difficult for me to afford it.
Other low-cost healthcare options, New Horizon Family Center in Greenville and Regenesis Healthcare serving Spartanburg, Union, and Cherokee counties.
Here are your medications. Do you have any questions for the pharmacist?
I don't.
Back at the free clinic, patients like Eller Hendricks get prescriptions right on site. She's upfront about the difference it's made as she deals with menopause.
And I started getting medications for what I needed and to feel relief. Oh my God.
Now, for the underinsured, they may qualify for Well Vista, a nonprofit pharmacy that sends you prescriptions for a fraction of the cost. And when it comes to vision, another nonprofit, Servants for Sight, who we caught bagging sunglasses for missions abroad, help thousands in the upstate get free glasses and even cataract surgery.
And we've had so many patients that will come back in the future and just tell us that we gave them back their life. We gave them back their hope.
So whether it's life-saving,
It's given me a chance to live.
or simply life-changing,
I can actually sleep up under the cover in the wintertime now.
paying for health care doesn't have to be a struggle if you know where to turn.
I can laugh about it now. I couldn't then. I was crying.
Now, programs like these have also helped to keep people out of the ER. And in addition to physical health, many also offer mental health care.
Diane, I'm glad that I'll start at the end. When you say it keeps people out of the ER, if healthcare starts expensive at some of these clinics, once you go to the ER, it is exponentially more expensive. So this is a cost saver in the big picture.
Yeah, it really is. And I just was hoping that this store would provide some hope for people at different tiers, right? Because some of this is available only to people who make 200% or below, I should say double the poverty line or below. And some of it's available to people who make more than that, but they can give it to you on sort of a scale there, and that makes a difference. Yeah, I think we have an example of that. So if we maybe put this full, Gordon, that people can see on the right-hand side there, there is the scale of your salary here at Unity Health on Main. And so someone may be earning, let's say you're earning between 15 to 18,000, you're going to be covered a lot more, obviously. But if you're a family of 5, earning, let's say the 45,000 or up to 73, that is the different kind of pricing scale that you would get based on the service. So you wouldn't be charged a full rate, and obviously the higher your salary goes, the more you would be charged. But it's an option for people who, may not have as much health coverage as that they like and don't want to have to pay as much out of pocket.
Sure. And when you mention out of pocket, even for people who have insurance, and you mentioned this, you referred to it in the story, the deductible gets to the point where, oh, sure, I've got insurance, but it's going to cost me so much up front, I still can't afford it even with the insurance. Right.
Deductible is a major issue. And obviously that changes on depending on what kind of procedure you get. But sometimes, obviously you have your personal care physician visit, yearly checkup is 100%. But what you don't realize is the lab work can be a lot, or any of those minor procedures that you might get might be a lot. And you may have to pay that completely with regards to, whatever your deductible limit is. And that can just be so difficult for families, especially if there's multiple members of the family who need health care.
I was surprised by the number of people you told me that this would impact, because certainly below a certain threshold of income, you can qualify for programs like Medicaid, and older folks can qualify for Medicare. And then a lot of people are required to have insurance now because of what the Affordable Care Act. But 1 in 8 people in South Carolina is actually an extraordinary number of folks who really need this extra option.
Yeah, it really is a big number. And if you'll remember, in South Carolina specifically, we were one of the states that didn't opt in to doing extra Medicaid coverage for people at a certain level in their salary, a certain poverty line level. And now you're seeing more states in that ballpark because of administration changes, back in Washington. But still, because of that, in South Carolina, we do have a larger portion of people who don't qualify for Medicare, or Medicaid, I should say, but they do not also qualify for have proper health coverage, and so they're in this kind of this gap, and it really presents a problem for a lot of people who just don't earn quite enough to cover these medical expenses, but not too little, that they qualify for Medicare, Medicaid.
Is the standard of care the same at these free clinics?
That's a great question. Yeah, I would say absolutely. In fact, all of the physicians and the staff there are either full-time staff dedicated to helping people the best that they can, or physicians that volunteer their time. So they're coming in from other major institutions in the area. So really, it's the same level of quality care that you would get at a major hospital, those same types of doctors. And when I was doing this story, Gordon, it was interesting because I passed by and I heard someone speaking Spanish, helping out one of the patients, and realized that volunteer was somebody that I knew at church, and had no idea that this man was fluent in Spanish. But you have a lot of members of the community also who come in there. They may not have medical background, but they're also there volunteering. It's just a wonderful organization, that free clinic.
It makes sense. My daughter in medical school, and all of her sort of medical school classmates, they also spend a ton of time at free clinics. You're not just necessarily seeing a medical school student, but they do provide a ton of volunteer time in these clinics as well.
And by the way, bravo to your daughter for not only going into such an admirable field, but it is terrific that they have these kind of training sessions where they're involving students who can come in and volunteer, and also are bringing a lot of knowledge with them.
Yeah, no kidding. So, Diane, for people watching this right now, they may be wondering, is this for me? You know what I mean? Because I have health insurance, you have health insurance, we have it from the same employer.
Right.
But we also are going to deal with the cost of health care being a real problem. Medication is expensive. The deductibles, as I mentioned, are expensive. It does add up, and even if you have insurance, it doesn't necessarily cover the full cost of everything you're doing when you are covered. So I imagine even not just the 1 in 8 people who fall into that sort of loophole here, income-based, but probably a much larger and larger and larger segment of the population is looking for this kind of thing.
Yeah, I encourage you to absolutely look into it. You might qualify more than you think. You saw that salary level went pretty high, especially depending on the number of kids that you have.
I was surprised.
Yeah.
There's a category here for $105,000 a year being 200% of the poverty line for somebody who has 8 kids. Now, or I'm sorry, 6 kids, a family size of 8. I mean, granted, that's a very large family, but $105,000 is also a lot of money.
Right. And so it's just important to have that knowledge to say, could I possibly qualify for some of this help that would reduce the cost, especially if you have, 6 kids. You're really going to need it because goodness knows they're, going to break an arm or do, what kids do and needing that medical care. I also want to pinpoint that pharmaceuticals can be, as we know, extremely expensive.
Tell me about it.
Yeah. And so Well Vista is something that I just want to be on people's radar. Yeah. Well Vista is terrific because it allows you to potentially take advantage of savings when it comes specifically to pharmacy needs. So instead of getting your drugs from CVS or Walgreens or whatnot, you can see if you qualify for reduced or even free drugs through Well Vista. They also have a tiered system with regards to your salary. But if you don't know about it and you haven't checked into it, you really should look.
And in this, I was going to say, it costs you literally nothing to research and see if you can save a few bucks on your drugs. This is Well Vista. You see the name on your screen spelled like that, wellvista.org.
Yes.
For those of you who want to search this at home. All right, Diane, parting note here on saving a little bit of money on this on healthcare here. What's your bottom line for people to watch out for?
I think the bottom line is that full honesty, it may not be for everybody. You may not qualify for these programs, but it's absolutely worth it to go check because you might be surprised.
All right, well, let's hope it works out for everybody out there, guys. We hope we've given you some good advice here today. We are always here to help. That's consumer expert Diane Lee. I'm Gordon Dill, and we'll see you again with a new episode next time.